Observe this scan. As we move through the anatomy, a massive visual distortion tears across the image. In CT imaging, these visual anomalies follow specific, predictable patterns, rather than being the result of random digital noise. Every artifact reflects a systematic interaction between the X-ray beam and the physical materials it encounters. To interpret a scan, a radiologist must determine the origin of the flaw, whether it stems from the X-ray beam, the patient's body, a mechanical failure in the scanner, or the geometric limits of the hardware. The FRCR physics syllabus groups these into 4 categories: physics-based, patient-based, scanner-based, and multi-slice geometry. We are going to trace these streaks, rings, and bands back to their root physical causes. Diagnosing the patient accurately requires first diagnosing the physical integrity of the image itself. We see this often in the posterior fossa of the skull, dark bands appearing across dense anatomical regions. This begins with the X-ray beam, which is polyenergetic, containing a spectrum of both high and low energy photons. When this beam strikes a dense structure like the petrous bones, the low energy photons are absorbed, while the high energy photons pass through to the detectors. This preferential absorption of soft X-rays shifts the mathematical average of the photons. The mean energy of the beam shifts higher, a phenomenon known as beam hardening. The detector reads this hardened beam and assigns a lower Hounsfield unit, assuming the high energy resulted from passing through less attenuating soft tissue. This miscalculation creates the dark, low attenuation bands seen slicing across the anatomy. Spherical objects exhibit a variation called the cupping artifact. Because the object is thickest at its center, the beam hardens more in the middle than at the periphery, leading to lower Hounsfield units in the center. Pre-patient filters can correct this by absorbing soft X-rays before they enter the patient. Additionally, bow tie filters pre-harden the beam at its edges to better match the patient's physical profile. Beam hardening reveals that X-ray attenuation involves a continuous shift in the beam's energy profile that must be physically filtered for accurate reconstruction. Other errors present as prominent streaks, usually seen projecting across the shoulders or hips. In projections traveling through the widest parts of the body, a high percentage of X-ray photons are absorbed before they can reach the detector. As the X-ray source rotates around the shoulders, the number of photons hitting the detector plummets, creating a severe drop in the signal-to-noise ratio. The reconstruction algorithm attempts to map this noisy data, generating streak patterns aligning with the widest horizontal axis. Adaptive filtering addresses this by smoothing regions of extreme attenuation before the back projection process begins. A second hardware solution is tube current, or MA, modulation. This system dynamically increases the tube's power specifically during the most attenuating phases of the gantry rotation to maintain signal integrity. This hardware ensures the scanner provides a consistent signal even when the anatomical path varies in thickness. Image clarity is also limited by geometry, specifically how detectors sample anatomy into individual voxels. The partial volume effect occurs when a dense object only partially occupies a measured slice. In this 3D grid, Stream 2 is entirely inside the dense object, while Stream 3 is entirely outside. Stream 1 sits exactly on the boundary. Stream 2 registers a high Hounsfield unit, and Stream 3 registers a low one, providing accurate data. Because the detector averages all data within Stream 1, it outputs a false mid-range value for the boundary voxel. This leads to a clinical certainty. Partial voluming will only reduce the apparent attenuation of a dense object. It cannot increase it. Utilizing smaller slice thicknesses minimizes this by increasing the geometric resolution of the scan. A related issue, incomplete projections, occurs when objects like the patient's arms are captured in some projections but not others, creating inconsistencies. In both cases, any structure smaller than the sampling volume will have its true density obscured by mathematical averaging. Beyond beam physics, some artifacts are the result of mechanical and temporal failures. A perfect circle appearing on an axial slice is known as a ring artifact. This occurs when a single detector element is faulty or uncalibrated. As the gantry rotates 360 degrees, the path of that specific broken element traces a circular footprint onto the final image. Back projection calculations translate this static point of failure into a perfect ring. Metallic artifacts are a severe manifestation of the same beam hardening and photon starvation physics we have already analyzed. Temporal errors result from patient motion, such as breathing or a heartbeat, which causes the scanner to record the same structure in multiple positions. We resolve this through shorter scan times, breath holds, and ECG gating to synchronize image acquisition with the cardiac cycle. The scanner assumes absolute temporal and mechanical uniformity. Consequently, any deviation is mapped directly into the final reconstruction. Modern high-speed multi-slice scanning introduces its own specific category of geometric errors. Helical artifacts were once a product of Z-axis movement, but they are mostly mitigated today by high-density detector arrays. The more prevalent issue in modern hardware is the cone beam artifact. Legacy scanners used a flat 2D fan-shaped beam. Modern multi-row detectors require a 3D cone-shaped beam to cover more anatomy in a single rotation. Because the beam expands, objects at the periphery are struck by X-rays at a divergent, sharp angle. This angle creates a blurring effect similar to partial voluming at the edges of the image, which requires specialized reconstruction algorithms to mitigate. Expanding the field of view necessarily alters the linearity of the beam, relying on algorithmic correction to maintain image quality at high speeds. Accurate CT interpretation requires an understanding of how physics influences the final image. Recognizing dark dams and cupping allows us to identify the effects of beam hardening. Streaks across dense regions point toward the limits of signal-to-noise ratios and geometric sampling. Perfectly circular rings indicate a specific hardware miscalibration, and peripheral blurring indicates the physical limits of cone beam geometry. High-fidelity imaging is achieved through the constant interplay between quantum physics and corrective algorithms. The resulting scan is the product of X-ray attenuation being captured, interpreted, and adjusted through these systematic filters.